If you have had dengue fever recently, the doctor may have advised a dengue ELISA test. And you're probably wondering, what is this test, how is it done, and what do the results mean? I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and we perform numerous dengue tests for patients with fever, and I'm going to tell you exactly everything you need to know about the dengue ELISA test. To begin with, you should know a little bit about what is considered to be dengue fever. Dengue is an infection which is a virus transmitted by the bite of the female Aedes aegypti mosquito. The fever starts very sharp and very fast. It starts suddenly, it will climb very fast, it will go to almost 104 degrees Fahrenheit, and it will stay for about 3 to 7 days. Dengue is worldwide in its spread. It is found almost all over the world. It is more prevalent in tropics like India and Africa, and the only way to diagnose dengue is through blood tests, of which the ELISA test is considered to be one of the most accurate and reliable tests. What is ELISA? ELISA is something which is a way of testing for certain proteins in blood samples. The full form of ELISA is enzyme-linked immune sorbent assay, and this is one of the oldest but most reliable and accurate techniques for diagnosis not only of viruses like dengue but all kinds of other proteins, antibodies in the blood that may be related to different diseases. It's a simple blood test. A sample of your blood will be taken. The serum or the white part of that will be separated out into the lab. That will then be processed in the lab through a series of very precise steps which are done only by trained personnel on specialized machines. The ELISA test results usually take a day or two, and your report will usually contain a value or a number which is the level of the thing that we are trying to detect. In this case, in case of dengue, there are 3 different types of ELISA tests which I'll describe in the subsequent slides. So a little bit about how the test is done. Your blood sample will be collected. A lab technician will insert a needle into a vein in your arm. Around 3 to 5 ml of your blood will be collected. This will be transported to the lab where it will then be centrifuged so that we only get the white part or the clear part of the sample, which is called the serum. This is then added to a series of small little wells. These are tiny little wells in something which we call an ELISA microtiter plate. These usually contain around 48 or 96 different small chambers. Your sample is added in a series of dilutions into these chambers together with a couple of other chemicals. It is allowed to incubate inside these wells. After that, a few more chemicals are added, and finally we check how much the color of your sample changes. The change in color will be proportional to the amount of whatever it is we are looking for, and in case of dengue, this is either the NS1, IgM or the IgG proteins. Why are ELISA tests recommended for dengue as compared to rapid tests? First of all, the ELISA will give you a value, it will give you a number, whereas the rapid test will only give you a positive or negative. Secondly, the minimum limit of detection of ELISA tests is better than that of rapid tests. So if you're in an early stage of dengue, the ELISA test will probably be able to catch it better than a rapid test. Thirdly, the ELISA tests are done with very specific and precise photometers we use to check the exact change in color using technology, machines and automated analyzers. Rapid tests are visually identified. They don't need any machines to provide the result. A human being will just check whether there is a red line or there is no red line, and the result is reported. The only problem with ELISA is it takes longer, it is more expensive, and it requires special equipment. What are the types of ELISA tests done for dengue infections? There are 3 types of ELISA tests. The first one is the NS1 ELISA test. This checks for the non-structural protein antigen 1, which is made by the dengue virus whenever it infects a human being. This is usually found in the first 7 days of the dengue infection. The other 2 types of ELISAs are also known as the ELISA MAC or the MAC ELISAs, are used to detect the dengue antibodies like the IgM and the IgG antibodies. Both these antibodies are present in the blood of patients who have been infected with dengue in the past. The IgM antibodies are present earlier, around 2 weeks after the fever begins, and the IgG antibodies will be present a little later, around 3 to 4 weeks after the fever begins. Both these tests are done, all 3 of these tests are done in the same way. The ELISA procedure is the same, the chemicals and reagents used are different. The dengue NS1 ELISA test is a specialized assay that we use to check for the NS1 antigen in your blood if you are infected with the dengue virus. The NS1 test will be positive in your blood during the first 9 days of fever. Usually it's present in the highest proportions around day 3 to 7 of the fever. And the NS1 test is a simple blood test in which your blood sample will be taken and processed using the ELISA technique in the lab. You will get a numerical result, which is usually, depending on the kit that is used, these numbers are different. One of the common kits that is used in India provides us with 3 different grades of the number. If the value is less than 9, it is negative. If it is between 9 to 11, it is considered to be gray zone, intermediate, or equivocal, which means we cannot tell if it's positive or negative. And anything more than 11 is considered to be positive. The test is extremely accurate. It has an accuracy of more than 99%, which means that if the test is positive, you're definitely certain that you currently have the dengue infection. The dengue IgM ELISA test is a similar test which is done to detect the IgM antibodies against dengue. These are usually present around day 5 of the fever in almost 50% of the patients, and these antibodies will be present in almost every single patient around day 10 of your fever. The procedure is the same. A sample of blood is drawn from the vein in your arm using a needle. It is processed in the lab, and we provide you with a number as well as a positive or negative result. A commonly performed test kit in India uses values as less than 9 being negative, between 9 to 11 being intermediate, equivocal, or undetermined, and greater than 11 being positive. The accuracy of this test is nearly 100%, which tells you that if it is positive, you are almost certainly infected, and you have had a recent infection in the last 2 to 3 weeks or maybe up to a month. The IgM test only tells us about an infection that already occurred. It does not necessarily tell us that you currently are carrying the virus. The dengue IgG ELISA is another ELISA test which is done to detect the IgG class of antibodies against the dengue virus. These antibodies are present in the blood around 2 to 3 weeks after the infection or the fever, and they continue to be present in your blood almost forever thereafter. As a result, the IgG ELISA test only tells us whether you have ever had a dengue infection in your life. Its value is more in secondary infections. That means when you have been infected the second time with dengue. It's not of much use in primary infections because it takes a long time to turn to be positive. Again, the values are similar for a commonly used test kit in India. A positive number is considered to be above 11. Equivocal, indeterminate, or gray zone is between 9 to 11, and if the number is less than 9, you will be given a negative report. The positive result is basically indicative of the fact that you have already had the infection in the past. The use of these tests is more for distinguishing between whether you're having dengue for the first time or you've already had dengue in the past and this is a secondary infection. Is the ELISA test better than the PCR test for dengue? The short answer is no. The PCR test is still the gold standard, but it can only be done usually in the first 3 or 5 days of the fever, after which the dengue virus will not be present in your blood anymore, and so the PCR test will be negative. The ELISA tests are used to detect the NS1 antigen, the IgM antibodies, and the IgG antibodies. So the PCR test has no value for detection of these things. Secondly, the ELISA test can be done all throughout the duration of the dengue fever to get at least or gather some evidence that you may have had dengue, and so it's got its pros and cons. But the PCR test is more accurate than the ELISA test. It actually finds the dengue RNA itself, and so it is preferred if you are in the very early stage of the fever or we need to know exactly which type of dengue virus you're infected with. We would go with the PCR test. When should you get which ELISA test done for the dengue virus? So if you're between day 0 to 5 of the fever, let's say you had the fever for less than 5 days, you should do the NS1 ELISA test. If you're between day 3 to 7 of the fever, you can do the NS1 ELISA together with the IgM ELISA. And if you're more than day 7, it's more advisable to do the IgM and the IgG ELISAs. It's important to get the exact value for the IgG and the IgM because there is something called the dengue IgG to IgM ratio, which helps us to distinguish between whether you're having the dengue infection for the first time in your life or this is a secondary infection. I've made a separate video on the IgG to IgM ratio. Please have a look at that. I've added the link in the description.